This lesson will review the muscles that act on the elbow and forearm. The elbow is a hinge joint, which means it can only do two things, flex or extend. The forearm is the area between the elbow and the wrist and has two bones, the radius and the ulna. As we hold our upper limb at our side with the elbow flexed to 90 degrees as shown in this graphic, we can turn our hand palm down or palm up because the radius rotates over the ulna. When we turn our hand palm down, we are pronating, and when we turn our hand palm up, we are supinating. Listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. These will again be displayed at the end of the unit for your review. Elbow flexion is the strongest elbow movement compared to extension, as we are constantly using our elbow flexors against gravity. The three major elbow flexors are the biceps brachii and brachialis, which are found in the upper arm area, and the brachioradialis, which is found in the forearm. These three muscles are visible in the graphic on this slide, showing their location in the upper extremity or upper limb. The major actions of the biceps brachii, which is commonly referred to as the biceps, are to flex the elbow and to assist in supination of the forearm. As it also attaches superior to the glenohumeral joint, it has a small function to also assist with shoulder flexion, which is why this muscle was first mentioned in the shoulder muscle lecture. It has two origins. The short head is slightly shorter than the long head, as it originates on the coronoid process of the scapula, while the long head originates on the supraglenoid tubercle of the scapula, which is a point just above the glenohumeral joint. Its major insertion is on the radial tuberosity and has a lesser attachment to the ulna by an aponeurosis, which is a thin sheet-like tendon. By its attachment to the radial tuberosity, the biceps is stretched when we pronate the forearm, and therefore it assists in bringing the forearm back to a palm-up position or supination. The brachialis is a deep muscle of the anterior upper arm, and its only action is to flex the elbow. It originates on the distal or lower half of the anterior humerus, and its major insertion is on the ulnar tuberosity. The brachioradialis is a muscle primarily found in the forearm region, and its only action is to assist elbow flexion. It originates on the outer or lateral end of the humerus in an area called the supracondylar ridge of the humerus, and inserts on the outer or lateral end of the radius in an area called the radial styloid. Elbow extension is a weaker movement of the elbow and is controlled by two muscles, the triceps brachii, often just called the triceps, and the much smaller anconeus. These two elbow extensor muscles are easily seen in the posterior view of the upper arm. As with the biceps, the triceps muscle was first mentioned in the shoulder muscle lecture as it crosses the glenohumeral joint and therefore assists with shoulder movements. Its major action is to extend the elbow. However, since it also crosses the shoulder joint, it also assists with extension and adduction of the shoulder or glenohumeral joint. It has three heads. The long head originates on the scapula just below the glenohumeral joint in an area called the infraglenoid tubercle. The lateral head originates on the proximal or upper half of the posterior humerus, while the medial head originates on the distal or lower half of the posterior humerus. This muscle inserts on the proximal or upper posterior surface of the ulna in an area called the olecranon process. The anconeus is a very small muscle which assists with elbow extensions. It originates on the lateral or outer end of the humerus in an area called the lateral epicondyle and inserts on the olecranon process of the ulna, as does the triceps. Forearm supination is the movement which rotates the forearm into a palm-up position. This is accomplished by two muscles, the biceps and the supinator. The biceps and supinator muscles can be seen in these anterior views of the upper limb. The biceps brachii was discussed in the earlier portion of this lecture, as its major function is elbow flexion. As it attaches primarily to the radial tuberosity, it assists with supination or turning the palm up when it is stretched by rotating the arm into a palm down position or pronation. The supinator is named for the fact that its only action is supination, or rotating the forearm into a palm up position. It originates on two ligaments of the elbow joint, and also the proximal or upper portion of the ulna, at a point called the supinator crest. It inserts on the proximal or upper portion of the outside or lateral radius. The two muscles which help rotate the radius over the ulna, resulting in a palm down position, are the pronator teres and pronator quadratus. These two pronator muscles can be seen in this graphic. Note that the pronator teres is found in the proximal or upper forearm region, while the pronator quadratus is found in the distal or lower forearm region. The major function of the pronator teres is to pronate the forearm. However, it is also a weak elbow flexor as it crosses the elbow joint. It originates on the inside of the distal or lower end of the humerus in a region referred to as the medial epicondyle of the humerus, and also on the inside or medial region of the proximal or upper end of the ulna at the coronoid process. It inserts on the outside or lateral surface of the middle of the radius. The pronator quadratus is located at the distal or lower end of the forearm near the wrist, and its only action is pronation of the forearm. It is located on the palm or anterior side of the end of the forearm and originates on the distal ulna and inserts on the distal radius. When we are young, the ligaments which hold joints together are weaker as we grow. As a result, it is possible to pull the elbow joint apart by a strong pull at the elbow, which can occur when an adult pulls in the upper limb of a child. This separation at the elbow is referred to as pulled elbow syndrome and requires a visit to a doctor to put the elbow back in place. The elbow joint will be weaker for a while as it mends, and care must be taken not to pull on the end of the arm again. As at the beginning of the presentation, listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. It is suggested that you should begin to study for a test on these muscles by using study cards with the name of the muscle written on one side and the actions and attachments of the muscle on the other side.